October is Breast Cancer Awareness Month, and it's pretty safe to say we have all been impacted by the disease in one way or another, as 1 in 8 women in the U.S. will be diagnosed in her lifetime, and 1% of men will also hear the words, "You have breast cancer." In this week's Healthy Living, we introduce you to a breast cancer survivor, a doctor, and a machine that all want to help save your life.
I got hit with a baseball, actually, and I had a lump. So that originally, I played softball.
Dianne Munroe went in for a mammogram after her softball incident more than 2 decades ago. She's been getting screenings every year since.
This is a test that people maybe don't keep on their radar as much as your other tests.
While 1 in 8 U.S. women will be diagnosed in her lifetime, Dianne didn't have any family history of the disease, and she was getting regular checks.
I didn't expect it. I didn't think I had any risk factors or anything.
Technology in the fight against breast cancer changed her outcome.
Thankfully, because of this machine, it was very early stage breast cancer.
It was Dianne's first time using the 3D mammography machine, but it would not be her last visit to CHI Franciscan's Highline Medical Center that year.
Detection one day, and then,
Her treatment plan was mapped out by her doctors almost instantly.
I mean, within about a month, we knew what we were doing, we knew what I had, and we were scheduling surgery for a lumpectomy.
She has more dense breast tissue, and that really did help detect her early stage breast cancer.
Dr. Fleisig says that the 3D technology is especially important for women with dense breast tissue, which usually occurs with younger women. She says the tech allows doctors to look deeper.
Instead of having just one piece of paper in terms of the mammogram, 3D uses digital technology to make essentially a 3D reconstruction. So instead of one page, you're actually looking at pages, like as if you're looking at a book. And so then you can see every layer. And
Dr. Fleisig says this 3D technology has been proven to be more successful than the traditional 2D mammograms in early detection.
And whenever you can find something that's smaller, that usually indicates that it's earlier stage. And when you can detect something earlier stage, patients have better overall outcomes.
It feels the same. It's exactly like any other mammography. It's just that the technology was more advanced, and it gives the doctor a better opportunity to look at your breast.
Dianne's outcome was not only impacted by her diagnosis.
I think for me personally, it's given me an opportunity to look at life differently. I don't take it for granted anymore.
Her outlook on life shifted, and she hopes her story will help shift yours too.
Early detection's the way to go, and don't be afraid of the machine, and don't be afraid of the process. Just get it done and go on and live a long, healthy life.
And that's what we want for everyone, a long, healthy life. Dr. Fleisig says talk with your healthcare provider about when to start screening. Typically, most women start their annual screenings between 40 and 45 years old. She also says in the fight against breast cancer, lifestyle modification might help. Have a healthy diet, minimize processed foods and alcohol intake, quit smoking tobacco, and get in a good workout 3 or 4 times a week. If you'd like more information on breast cancer or other healthy living topics, just go to our website, q13fox.com/healthyliving.